Welcome to this week's Health Corner. My name is Dr. Parker. Today we're going to talk about acid reflux in adults. And to do justice to this, we have a consultant, gastroenterologist, Dr. Reshma Rakshit, who will discuss acid reflux, the way we should understand it. Acid reflux is very common, but I'll leave the consultant to tell us everything about it. Dr. Reshma, you're welcome to Health Corner.
Thank you for inviting me.
We've had you on Health Corner twice, and people are quite impressed. Obviously, we've learned a lot from what you tell us. So, acid reflux is another one. I'm sure you have some things to tell us. And what is it that we should know about acid reflux? And is there anything we can do to help with this problem?
Well, thank you for inviting me again. It's been a pleasure. This is a very common topic, and that's why we were talking about it. 20% of the population, which means 1 in 5 have this condition. And it's something that really makes people suffer. Sometimes they suffer in silence, and what I want to do is to make you aware of what you can do to understand your condition, to prevent it, and to help with the treatment. So we're going to go through a few things. We're going to go through what is acid reflux, what your symptoms are, how we diagnose them, how you can help yourself, which is key in any other treatments. So I wanted to talk about acid reflux being indigestion or heartburn. Most patients use those words. They feel a symptom of acid or burning in their chest, sometimes in their mouth, and they find that it's worse in certain positions after eating, and we're going to talk about that in a more detail. If you see at the diagram at the back here, you'll see that I've got the digestive tract. The long green tube is your gullet, also called the esophagus, and then you've got the stomach, and it's the junction where that little black box is. That's where all the science behind reflux is. So I wanted to show you what a normal upper digestive tract is. And you'll see you've got the gullet, and then underneath the gullet I've said something called the diaphragm, which is a muscle which runs all across. That muscle's got a little hole into which your gullet fits in and your stomach's at the bottom. Okay?
So the diaphragm separates the chest, the lungs from the
tummy. Quite right. And there's a hole here, and that hole holds this structure in place. There's another point here as well. Within the gullet, which is the tube, you've got a little, you'll see it says sphincter, or a little muscle at the bottom, which is like a valve. It's a one-way valve, which allows food to go down and prevents any of your stomach contents from coming up.
So that's the red spot.
That's a little red spot, which I've marked as sphincter. Okay? And this is what it should normally look like. But in patients with reflux, what happens? 2 changes can happen. One is where you see where I've mentioned the diaphragm. The hole in the diaphragm can become bigger, so your stomach can come up and down into the chest, and that little bulge at the top of the stomach is called the hiatus hernia, and that can move up and down, and that can allow your stomach contents to come up.
So part of the stomach going through the diaphragm, that's the hiatus hernia.
That's right. A second problem occurs in reflux, which is that little muscle I said, the valve at the bottom, the sphincter, that can become loose. So not only is your stomach traveling up and down, but the valve has gotten loose, so the contents of your stomach will go up into the chest, causing symptoms.
So the valve becoming loose, is it because of age, or does it just happen in some people?
Well, there are many reasons why it can happen, and sometimes it's related to things like obesity, gaining weight, being pregnant, but some other patients we don't really know what makes the valve loose. But they can cause a lot of symptoms. Most patients know as heartburn or indigestion, but actually acid coming up in your gullet can cause cough, because the acid can go right up through the throat. It can cause pain in the chest, But beware, if you have pain in the chest, you must see your doctor, because the first thing we must do is make sure this is not related to your heart. But once that's been checked out, then actually some chest pains can be caused by acid and they can be treated. Sometimes the acid causes burning in the gullet and can cause difficulty in swallowing. But if you have difficulty in swallowing, it might also mean a sinister problem, like a cancer or a lump in the gullet. So again, see your GP if that happens. Some patients have a bad breath, they can have hiccuping, they can have bloating, and sometimes hoarseness of voice, and all of these can be signs of reflux. So acid reflux is not only heartburn, it can cause other symptoms as well. So you asked me a question about who gets acid reflux. It's so common. So, you know, we talked about the valve becoming loose in pregnancy. So acid reflux is really common in pregnancy. Many of you ladies have had it, haven't you? If you're overweight, you have more reflux. If you've got a hiatus hernia, then as I showed you, you have acid coming up. Smoking, unfortunately, loosens that valve. So that can aggravate acid reflux. Certain foods like fried food, fatty food, alcohol, they can also increase acid reflux.
So our lifestyle can actually...
Very important, very important. And I'll come to that in a bit, how you can change all of these things. If you're very stressed and anxious, your stomach produces more acid, so you have more reflux. There are certain medication a lot of people take, painkillers, anti-inflammatory painkillers. You know, ibuprofen, Nurofen, you buy it for your headache. Actually, you might be aggravating their reflux. If you eat very large meals, you know, your stomach's going to pour in the acid to try and digest the meal, and then it causes more reflux because the valve isn't working. And if you wear a very tight clothing in the middle, so very tight bra, very tight belt, that can increase the pressure on the stomach and cause reflux. One other point is sometimes, you know, you've heard about the advice, don't eat and exercise, don't eat and swim, because you want the stomach to empty before you're doing these exercises, which can cause the acid to come up the wrong way. So how do we diagnose it? Well, you see your GP. Your GP would then look at your symptoms and would diagnose you with reflux. If they are worried, they would send you to a specialist, and then you can have more tests, like an endoscopy. And you can see the picture here, which tells you about an endoscopy, which is a camera test to look into your gullet, and it can be done as a day case to see if there's problems. If you've got a hiatus hernia, have you got burning of the gullet, etc. Sometimes some people, small number of people, need more specialized tests, and I've mentioned there 24-hour pH or manometry tests. These are called esophageal function tests. Not everyone needs them. These are rare things that specialists can organize for you. Now, the most important thing you all want to know is, how do we treat it? And, you know, a lot of it is in your hands, so it's about changing lifestyle. Some of it is medical therapy, and very rarely do people need surgical therapy for this. So, what you're going to ask me?
Lifestyle, because if we start with lifestyle, what are the things people can do which they probably don't know?
That's right. I think some of the things are common sense. So you want to eat regularly, avoid eating late at night, avoid filling up the stomach too much. So you want to eat little and often. Avoid very large meals, end of the day. A lot of my patients eat their main meal of the day at lunchtime and a much smaller portion of food in the evening. They avoid supper, so nothing to eat or drink, no tea, coffee, your glass of wine just before you go to bed, because all you're going to do is increase the acid, increase the reflux, and suffer overnight.
You know, you spoke to us previously about irritable bowel syndrome, and you remember we talked about people skipping meals and then going to eat heavy meals late at night. So that can actually cause heartburn. That can cause heartburn.
That can aggravate heartburn a lot. And you know, the other things that I've put on the chart here is excess alcohol, because alcohol is acidic. If you're having carbonated drinks or fizzy drinks, imagine all those bubbles going into your stomach, expanding, causing more acid reflux. So these are simple things you can do to before you see your doctor even, to try and help yourself. The other things I've mentioned on this slide are very important. You know, weight is an important factor because it can loosen that valve. And if you've gained a lot of weight suddenly, take your time, lose your weight. You will find your acid reflux improve.
Right.
You know, a lot of pregnant women, once the baby's born and they've lost the weight, the reflux goes away, you know. You want to avoid wearing very tight clothing. You want to stop smoking, you know. And there's some things that you can do at home yourself. So, you know, we have acid reflux because the stomach contents are coming in the gullet. So when you're lying in bed at night, imagine your stomach is full of the acid and you're lying flat. All of that will go through into your gullet.
Right.
So what you can do is raise your head. Put a few pillows, raise the head end of the bed, or raise the mattress, or have a wedge pillow.
Right.
And then what you have is your head and your gullet are above your stomach. So the chances of acid reflux are a lot less, and you won't have nighttime symptoms.
And we've already listened to the risk factors. This is just the first segment. Stay tuned, don't go away. When we come back, we're going to talk more about acid reflux.
Meet Anne. Anne is thinking about sending goods to Africa. Her first thought came to MDS Cargo. Send goods to Nigeria, Ghana, and many more countries in Africa. Excellent customer service and after-sales support. Free London and Essex collection. Online tracking.
Health Corner on Ben TV by Crystal Life is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystal Life.
Welcome to the second segment of Health Corner. We're talking about reflux disease. Well, this is acid reflux in adults. Now we have the specialist, Dr. Reshma Rakshit, talking about the different things we can do to help the symptoms of acid reflux. Now, if you're joining us and you missed the lifestyle part, this is very important because it's something you can do yourself to reduce the symptoms. So I crave the indulgence of the consultants to go back to lifestyle and tell us again what we can do to help with these symptoms. Dr. Rakshit, is that all right to go back and let's start with lifestyle part 1 again?
Absolutely.
Right?
I think this is the key part because this is a disease that you can control on your own, and a lot of things have to do with lifestyle. What do we mean by lifestyle? It means how we're eating, what we're eating, and when we're eating. So what you want is your stomach to have enough time to empty itself rather than overfilling it so that it allows the acid to come up.
Right.
So we want you to eat regularly, avoid eating, skipping meals, and avoid eating late at night, because the later they eat, the more the stomach is going to be full, and then the acid will come up. What you also want to avoid is filling up the stomach too much. So often I advise patients to have little and often. So rather than 3 big meals a day, maybe having 5 or 6 snack type meals. Some patients find changing the main meal of the day from dinner to lunchtime really helpful, and then naturally our digestion slows down during the day, and by the end of the day, you're having the most little portion. Avoiding a nightcap, avoiding the tea, coffee, hot chocolate, or the drink before bed, because that will certainly lead to reflux. What you also want to do is avoid bending down or stooping forwards or lying down after eating, because you've got your gullet and you've got your stomach and you've eaten, so your stomach's full, lots of acid. If you bend and do housework or gardening or lie down, guess what's going to happen? It's going to go all the way up, and the acid's going to come up the wrong way up. And so what you want to do is give your stomach about a couple of hours to empty itself, and then do these things. Okay. Or again, we've talked about this before. Lifestyle, smoking, alcohol are very important. Smoking can make that valve even looser. So you're going to aggravate reflux. And excess of alcohol does increase acid production in the stomach and worsen the reflux.
Right.
The other thing I wanted to touch upon was carbonated or fizzy drinks.
Yes.
You know, we're all drinking all of these days. It overfills the stomach with gas. And then the food and the gas have to expel, and then acid comes up with it.
Right.
So there are a few other things that are quite important as well. You know, we talked about overweight or obesity leading to more reflux. So you want to have a healthy weight. You want to avoid wearing anything tight in the middle, because that's going to increase pressure on the stomach, increase acid reflux.
Right.
And one of the things I advise patients, you know, is to raise their head end at night. So your head is above your stomach.
Yes.
So using pillows like a wedge pillow, or raising the mattress, or raising the head end of the bed often helps. And then you're not left with reflux overnight.
Right.
And the final thing to mention is, we know stress increases acid production in the stomach.
Yes.
So finding ways to relax in our busy lives these days is really very important.
Yes.
So I wanted to also touch upon some medication, because a lot of people with reflux have to take medicine. You have to see your doctor about it. There's various kinds of medication you can be given. Some of the simple antacids over the counter that you can get in supermarkets can help with reducing the stomach acid, but they can't heal ulcers. Okay. Then you have certain types of medication which are called H2 receptor blockers. Sorry, I'm using scientific terms, but they reduce acid secretion and they're taken at bedtime. But they're not as good as the main medicines we use in this condition. They're proton pump inhibitors. There's lots of them around. Your doctor can prescribe these for you. They are best taken 30 to 60 minutes before meal times.
Right.
And that's very important, because these tablets need the time to make the acid pumps in your stomach shut off.
Right.
And then when you eat, there's no acid to cause symptoms.
This is important, yes, because some people with this condition take the proton pump inhibitors, but they actually don't know when to take them and when not to take them. So some people might just finish it and then take them. That's actually not
It's too late. It's too late. That's right.
Very good.
Now, I mentioned before, very few patients need surgery. And the surgery that's done corrects two problems. One is, we talked about that valve. It tightens the valve.
Yes.
And the second thing, what they do is they try and reduce that gap within the diaphragm. You know, we talked about that muscle.
Yes.
And one of the surgery is called fundoplication. It's a long term. Some of you may have heard of it.
Yes.
But you know what? Not everyone needs it.
Yes.
I wanted to touch upon some complications of reflux, you know.
I was about to ask that. Yeah.
Because it can be simple, but if it's undertreated, or if you're not treating it properly, it can cause problems. And the problems occur because of the acid causing burning of the lining of the gullet.
Right.
So you can have, as I've shown in the first picture, something we call esophagitis or inflammation. Now, if we kind of leave that, that forms an ulcer. Okay,
Right.
the second picture at the top.
Okay.
And then you can have, over a long period of time, if you're having constant acid reflux, the gullet changes its lining. And it's something called Barrett's esophagus, which some of our patients may have heard of.
Yes.
Now, that's serious, because that can be precancerous.
Yes.
Okay, doesn't happen to everyone. Small number of patients, but it's something we need to be aware of.
Right.
That's the third picture on the top.
That picture.
You can see that the gullet looks more red than normal.
Yes.
Then, if you imagine the gullet being a long pipe and it's constantly being inflamed and the body's creating scar tissue, then the opening in the gullet can become narrow. And that's the fourth picture at the top, which is called an esophageal stricture.
Right.
And you know, one of the symptoms is that the food doesn't go down.
Right.
And that's why that's important to prevent that from happening. Because once that happens, we can treat it, but it becomes tricky.
Right. So that's due to scarring.
That's due to scarring over a long period of time. And you know, we can do treatment by putting in a balloon and stretching it open, but these are risky procedures.
It's too late also.
It's too late.
Right. Okay.
And we have some patients who actually come from their dentists, and the dentists tell them, your teeth are terrible, you've got dental erosion,
Yeah.
go and see your doctor. And actually, some of these patients have significant acid reflux, which is eroding the teeth.
Right.
So these are some of the complications of reflux.
Right.
Well, acid reflux, many people try and treat it at home, but when you're having persistent symptoms or worrying symptoms, okay? And by worrying symptoms, I mean difficulty in swallowing, vomiting up blood, losing weight, and the reflux just won't settle. Please see your doctor urgently in these cases. We can manage these, and sometimes this is something more serious than simple reflux, and that needs to be diagnosed.
Okay, this is very good. I thank you so much. I know you've summarized. The last slide is just a summary of what you've been discussing. Viewers, today is acid reflux in adults, and we have the pleasure of listening to Dr. Reshma Rakshit, who is a consultant gastroenterologist in the UK, and she's told us a lot about this condition. Remember, lifestyle. It's always lifestyle. Lose weight, stop drinking alcohol if you have these symptoms. Stop smoking. You know, there are things you can do, healthy lifestyle, healthy eating. The takeaways, you have to cut down fizzy drinks, sweeteners we've listened to. These are things we don't know. And if your doctor prescribes one of the medication called PPI, where I won't mention the names, but the doctors, they will tell you, take this half an hour to an hour before you eat, so that it will act on the glands producing acid in your stomach. And remember, after a long day's job, don't come home and eat heavy food and lie flat on your stomach, or go bending and gardening, because you are increasing the acid refluxing going back into your gullet. I thank you so much, Dr. Rakshit, and we've listened to you and you've done quite a good job. Viewers, take look at the screen, the number on the screen, and if you have any questions, especially the difficult ones, I'll pass it to the consultant. Now, look at our website. You have more information there. If you want to partner with Health Corner, you're always invited. Thank you very much, and it's been a pleasure having Dr. Rakshit to Health Corner today.
Thank you very much for inviting me. It's been a pleasure for me too. Good day.